Less than a week away from the polls, US President Donald Trump has chalked up the rise in COVID-19 cases to an increase in testing. Another statistic gives it all away. There has been a 46% increase in hospitalization of COVID-19 patients in America in the last 1 month. And once again, the healthcare system is overwhelmed. A New York Times report describes how doctors in El Paso, Texas were airlifting patients to hospitals far away while treating others in a field hospital in a nearby parking lot. Recently, White House Chief of Staff Mark Meadows said the government was no longer trying to contain the virus because, I quote, it's contagious like the flu. Instead, they're focusing on therapies and vaccines. Soon after, the WHO Director General acknowledged that pandemic fatigue was real, but we must not give up. Countries like Italy that regained control over the virus, or Czech Republic, which didn't have a significant outbreak, are now staring at the prospect of a lockdown. This pandemic fatigue, this lockdown fatigue is very real. Yesterday, hundreds of people turned out in Italian cities to protest the latest COVID-19 restrictions. India's own national numbers continue to look sunny, but the exceptions, they are the ones to watch out for. Delhi saw its highest ever single day spike in new COVID-19 cases yesterday. Schools and colleges will now remain shut till the end of November. Karnataka has joined Mizoram in shutting down the few classes that they had started after local spikes in cases. Mizoram's capital Aizawl has gone under a week-long lockdown, and 7 months into the pandemic, the state has reported its first COVID-19 death. I'll end with a new study that's being discussed in the scientific circles. Why do healthy patients get severe COVID-19 infections? Who is more likely to get long COVID? Researchers from the reputed Lowen Center for Human Immunology, Emory University in the US, studied 52 COVID-19 patients in the ICU. They found over 50% had antibodies that were attacking their own cells. None had a history of autoimmune disorders. Here's some context. How the body usually reacts to a virus is by producing antibodies that lock onto the virus and neutralize them. But sometimes the immune system wrongly reads the body's own cells as a virus and produces antibodies against them, which is what causes inflammation and organ damage. The Lowen Center says this may explain long COVID, where the body keeps reacting to something it thinks is the virus, but isn't. But it is not as terrible as it sounds. We have drugs that suppress such responses. In fact, this might also explain why dexamethasone, an immune-targeted therapy used for lupus, has been relatively successful in treating COVID-19. I'll end here for today. My name is Pallavi Prasad, and if you find this COVID bulletin helpful, please share this video. You can also find us on YouTube if you click on the link in our bio. Thank you so much for your time today.